Like we are back. Let's see, there's a little lag here, so we're going to see what it looks like before we start sharing again. There's always a little lag. So, yes. It's hard to tell. Are you guys with us? Is anyone on? Can you see us? Are you hearing us? Looks like it's a little bit of a delayed. I wonder if we went out.
Not coming across well.
It isn't? No, it's like it stopped. Right. Oh, wait, but no, now it's going better. Wait. Yeah, because you aren't moving. Okay, so, you know what? I feel like, oh, someone just commented. Let's see.
We can just go audio.
Can you guys, Tony, can you hear us? Actually, the video looks good now. Gina, everybody who's tuning in, can you hear this well? We were having trouble. I'm going to, because it looks good right now, I'm going to share it. Oh, it's working now. Thank you. Okay, so I'll share it to mine pages, and then we'll share it to yours. Thanks, everybody, for your patience. Oh, you gotta love live streaming. You can't make this stuff up. Okay, so I just have one more, and then I can do yours.
Okay.
And then we'll get back at it. We got lots of great stuff to talk about. Okay. All right. Oh, thanks. I love when people tell us that it's working. Okay. So now I gotta, yeah, it looks working much better now. Okay. Got one down. Okay. Share to a page. Hi, Mom. Sandy's on. Thanks for tuning back in. We're almost there, peeps. One more, and then we'll start over again. Okay. Okay, now you'll be able to see it from there. Okay. I really appreciate all of your patience. Oh, thanks, Di. Yay! I had to take it off the Mevo hotspot and connect it to the Wi-Fi, which actually the Mevo spot had a stronger signal. So for those of you who've done live streaming with professional equipment, you know it's always Murphy's Law. You never know what you're going to get. It's kind of like life, right? Right. Yeah, and Joe and I, Dr. Joe Biernat and I have known each other a long time. And so if you are just tuning in with us, my name is Carla Berlin. This is Around Town TV, a live show. Yes, this is our take 4.
Take 4, at least.
Yes, at least. And I'm so excited to be at Minnesota Joint and Spine. And a lot of you may have seen my promo posts. If you're somebody who suffers with back, neck, elbow, wrist, hand, foot, ankle, knee pain is a big one. Yep, we talked about carpal tunnels, yep. Arthritis.
Yep, any type of arthritis. Yep. Soft tissue injuries, torn meniscus, things like that.
Yes.
All respond well to what we do.
Absolutely. So if you're someone who's suffered with any of that, you're going to want to stay tuned in. Please share your experiences. Feel free to ask questions. If you're not comfortable posting live questions, you can message us privately. I will make sure when I'm done with this that I tag Dr. Joe Biernat. But it is also, if you look under the shared, and if you're watching under my profile and it's shared, you will be able to go to his profile and see it. And then you can tune in. But Joe was just starting last time to share a little bit about his background, and we were getting into more. So let's go back to that to explain to people.
So I've been in practice about 20 years. Done a lot of different things in my practice, do a lot of nutritional stuff, and you know, over the past 5-6 years we've added in the regenerative medicine portion of the practice. And regenerative medicine is really growing by leaps and bounds. There's a lot of clinics around that do different types of regenerative medicine, and all very, very effective, very good results.
For those who don't know, what is regenerative medicine?
So regenerative medicine is, there's a lot of things that fall under regenerative medicine. So you know, nutritional supplements would fall under that category. Things like prolotherapy, if people are familiar with that. You could throw Botox in there if you wanted to. Yep. Platelet-rich plasma injections, stem cells. So anything that is designed to repair and rejuvenate, regenerate the body would fall under that category. So obviously tonight we're going to be talking about stem cell therapy specifically, but there are a lot of different things that fall into that regenerative medicine category. So
Well, yeah.
people are making a push toward regenerative medicine. I feel like people are, they're tired of just taking pills to cover stuff up. They want, they want to maintain their active lifestyle. They want their injuries to heal faster. And this regenerative medicine, you're starting to see it in all types of the professional sports. You've got, pitchers that are choosing, stem cell therapy as opposed to Tommy John surgery, and other athletes are getting these injections for different, injuries and arthritis, and to maintain their performance, especially with the money that's involved with those guys.
Well, and regenerative medicine is definitely the future, and especially for people who want to avoid surgery and downtime, whether it's a job or even if you're an athlete. There's so many more people choosing this route. And for those of you not familiar with Dr. Joe Biernat, he is has a doctorate of chiropractic from Northwestern College. He co-founded Minnesota Joint and Spine in Maplewood in June of 1998, and then in 2001 opened the clinic over here in Spring Lake Park, where we are today, or right now. He also has extensive training in human nutrition, and for those of you not familiar, he spent time playing not only college, but also professional baseball. He played some time in the Chicago Cubs minor league, and he also played on the two championship seasons with the St. Paul Saints. And Joe is not one to brag about himself, and I know it makes him uncomfortable, but the reason I want you to all know this is he is an incredible athlete. He understands that side, but he also understands the other side of somebody who isn't an athlete, who has degenerative diseases, which we'll get into some of those as well. And you also have clinical faculty status with Northwestern Health and Sciences, correct?
Yep, we've had quite a few interns over the years, bringing the younger people in and helping them learn the craft and build a practice. So
he's a good teacher.
We've been doing that for a while.
Yeah. So for those of you just tuning in, my name is Carla Berlin, and we're going to be talking about regenerative medicine, and we'll get back into some questions. But I have Dr. Joe Biernat on our show tonight, and you may have seen him a few months ago, and we're excited to have him back on. We're actually in the clinic where you'll get to see and learn a little bit more about what we're talking about. Right. If you're someone who suffers with pain, or you know somebody, especially knees.
Especially knees. Knees is a big one.
Yeah.
A lot of people have trouble with their knees, and so it's not just athletes, but just people that want to, maintain their active lifestyle, walking, running, biking, people that spend time at the cabin, you don't want to be laid up in the cabin with an ice bag on your knee. So,
right.
But
especially in Minnesota when you only got like a day of summer.
Yeah, right. Summer's 3 days long.
Right.
Exactly.
Right.
Exactly.
So I know we were jumping around because we, had the show going in and out. We did talk a little bit about regenerative medicine, but did you want to continue down that path on stem cell and explain a little bit more about that, or where do you want to go?
So let's talk a little bit about stem cell. So stem cell therapy's been around for a long time. The first recorded successful stem cell transplant was way back in 1968.
Wow.
So
50 years ago.
50 years ago, yep. So you had a couple of kids who were immune compromised, and they got a bone marrow transplant for that immune compromised situation. So I know a lot of people feel like stem cells are really new and cutting edge, and it is, but what is really new and cutting edge is our understanding of exactly what stem cells are, what they can do, and when a person gets a stem cell injection, what exactly happens. So it's not that this procedure or this action is new. I mean, we all have stem cells in our body at all times, repairing and regenerating. What happens as we age, our ability to produce stem cells decreases. At our age,
I have none.
if you are going to go into the hip and take stem cells out of there, about 1 in every 400,000 is going to be a stem cell.
Oh, wow.
Somebody who's 70 or 80, you're probably looking at 1 in every million or 2 million, based on what the studies have shown. Right. So, which is why we age. When a child falls down and they skin their knee, it heals up relatively quickly because they have a lot more stem cells to do that repair work. So we just become less and less efficient. So what stem cell therapy does is it makes up for that body's lack of stem cells and it's a way to supplement the body and help it repair itself. So, and there are different forms. There's PRP, which is platelet-rich plasma, which I call that indirect stem cell, because with PRP what you do is you take blood out of a person, you put it into a container that looks like this, and then you centrifuge it. You centrifuge it for 15 minutes.
Which is that machine over
Which is
here?
that machine there.
Okay.
So what comes out is a small portion of platelet-rich plasma down here. So all of the cytokines and the growth factors and the signaling markers and all the good factors of the blood get concentrated.
Wow.
So when this gets put into the body, you don't have any stem cells in here. But what that will do is that will signal your body to send stem cells to that area. So it will kind of increase that healing response.
Wow.
So this is a form of what I consider indirect stem cell. Then you can also take it to the next step where you can actually extract stem cells from the pelvic bone.
Wow.
There you're actually getting true stem cells, and then that can be concentrated and re-injected into the knee or wherever the person
Is it
needs
painful?
Typically not.
If they're already in pain.
If they're already in pain, yes.
Yeah.
The extraction site can be uncomfortable. And then injections are injections.
Right, right.
So, we use different things like freeze spray. Sometimes we'll put a little Novocaine in the area if we feel it's necessary. But overall, the procedures are done relatively quickly, so it's not.
And if you're already in pain, this is a way to get you out of pain.
Right.
And theoretically, and
Right.
and a few of you have jumped in and out. If you are tuning in, my name is Carla Berlin, and we're at Minnesota Joint and Spine, and we're talking about regenerative medicine, stem cell therapy. For those of you who may or you know of somebody who suffers from pain, and Dr. Joe Biernat is just kind of going over how that is all done and the injections. I know I was jumping around a little bit from what I said I was going to ask you, but what did you want to talk about next with this to explain it to the viewers?
So just to finish up on the different types of stem cell, we talked about the PRP, we talked about the bone marrow where they take it from the hip. It can also be, you can also get them from amniotic fluid or umbilical stem cells. So you can get it from the umbilical cord. So in those cases, they're extracted from a woman who has a scheduled C-section, live healthy birth, very stringent regulations on the handling of the tissue and the processing of it. What we like to use here is actually the umbilical stem cell. The reason we do is it eliminates the extraction site. We don't have to go into anyone's hip.
There you go.
And the number of stem cells is more concentrated. Somebody who's my age, I'm 47 years old, in my hip, about 1 in every 400,000 cells is a stem cell.
Right.
When you get into umbilical stem cell, you're looking at stem cell concentrations that are 1,000 times greater.
Wow. So for those of you, when I was talking about is it painful and whatever, what he's talking about is the umbilical stem cells. So you wouldn't have to worry. He would have it here for you.
There are companies out there that you can purchase it from. So, and by the time those stem cells get here to the office, they've already gone through 3 different independent FDA registered laboratories for testing, and very clean.
Yeah, I know we talked about that on the last show too, and just the importance of that, of anything you're putting in your body. But when everything's FDA regulated,
it's
and
they're tested for sterility. Make sure they're tested for communicable diseases on multiple levels, and so the risk factors are far lower. And when you go into someone's hip and get the bone marrow out of there, that's a potential site for infection and things like that. And I'm not trying to detract from the bone marrow. It is an excellent procedure, works extremely well. So we're not saying that our way is the only way. It's just one of the ways.
One of the several methods. But I've known Joe for 30 years, and I can tell you, this guy, when he does something, he does it top notch. We've sent a lot of our family friends to Dr. Joe for various reasons and things that have gone to other surgeons and doctors and specialists that couldn't find it. And you know, I always tell the story of when you found a piece of glass in someone's foot that was causing the problem.
Yeah.
You know, I mean, this
Quite
guy
well.
is good at everything he does, from sports to you're a great dad, husband, and of course, chiropractor, and now what you're doing here, I know you're one of the best. So that does make sense. What types of conditions can stem cell therapy treat?
So obviously knees are a big thing. Knee pain, knee arthritis, especially as we age, becomes very, very prevalent. We've dealt with some spinal issues. Think people have arthritis in their spine. We've dealt with elbows, ankles. Can deal with carpal tunnel, meniscus injuries, things like that. So there's a very broad range of things that can be treated with the different types of stem cell.
We have a question. It's actually
Yes.
Diana Pierce.
Oh, wonderful.
Yeah. On the nutrition side, what does the doctor think of injectable vitamins or injectable ear? I wasn't sure. It might be a typo. Yeah, right here.
Nutrition side or injectable ear. I know there are different IV.
Energy shots taken by the Kardashians.
Oh. There are different intravenous applications for different vitamins and things like that, and glutathione and things of that nature, and they work very, very well. There are applications for IV stem cells as well.
Oh, okay.
And a lot of it is showing a lot of good promise.
Oh, that's great to hear. Oh, thank you. Okay.
And those IV applications of vitamins, that would be another form of that regenerative medicine. And there's a lot of good benefit to that stuff.
Oh,
Very good stuff.
wonderful.
We don't do that here. I know there are clinics in the area that do that.
Okay.
So if people have questions on that,
Yeah.
there's a doctor that I used to work with who does do that.
Oh.
They can message me personally,
About that,
and then I'll
and you'll connect
act as a
them.
go-between.
Yeah.
Absolutely.
Awesome.
Absolutely.
Wonderful. Okay. Well, and back to what we were talking about, the different conditions, and it's an alternative. What you're doing is also an alternative to surgery, because
Right.
you don't really
Right.
want to do surgery unless you absolutely have to.
Right. And
Yeah.
sometimes it just gets to the point where you don't have a choice.
Mm-hmm.
So, and if you look at, say, knee arthritis, there are different treatments out there. You get people that, they can get away with heat, ice, some over-the-counter painkillers. Some people go in and get cortisone injections. There are gel injections for the knee. Stem cell is an option. But sometimes you take a patient history, you take an x-ray, and the joint is just too far gone. There's times that, I refer people out for knee replacements when it's necessary, because, everybody, at certain times you reach a point where, nothing else is going to be.
But I've also read a lot on why you should avoid knee replacements. Why should you? I'm going to ask you as the doctor.
There are risks involved.
Mm-hmm.
Knee replacement is a very final solution. Now, there are people out there, best thing they've ever done is a knee replacement.
Right.
There's a time and a place for it. But you risk infection, you risk failure of the replacement, you risk loss of mobility, things like that.
I've also read like heart disease can go
You can
statistics.
throw a clot or something like that. So there's a lot of different risk factors involved. But again, there's a time and a place for it. But the way I look at it is, you want to try everything that you can, on the more conservative level.
Right.
One thing I always tell the patients is, if your car won't start, you're not going to replace the motor first thing.
No.
You're going to check other things. Make sure you got gas in it, check spark plugs, things like that.
Yeah.
And knee arthritis is no different. Try the over-the-counter stuff. Try good glucosamine supplement. Maybe some gel injections, stem cell. Try it all. And if none of that works, or it gets to a point where that's not working anymore, you can always do the knee replacement. So
the future of regenerative medicine is here. What are the benefits of regenerative medicine?
So the benefits, and I'm going to speak specifically to the umbilical stem cells.
Yeah.
You've got very potent anti-inflammatory processes that go on in there. It will help with the current inflammation. There are things in there that will help block future inflammation. Some of the things that we talked about before, some of the heavy-duty chemical stuff, interleukin-1, receptor antagonist, things like that.
Right.
It's a very potent antimicrobial. So
I say right like I know what he's talking about.
an antibacterial, antimicrobial effect to it. It has a strong regenerative component to it. When those Stem cells are injected, they're going to replicate themselves. And what the laboratories have shown is the umbilical stem cells can replicate themselves about every 28 hours for anywhere from 60 to 90 generations. So you're talking, 60 to 90 days or more if that's what's happening in the body. So you can rebuild, regenerate, restore tissue. And the nice thing with stem cells, regardless of where you get them, whether they're from the hip or from the amniotic fluid or the umbilical, it's all going to respond to what your body is signaling for. If you tear your meniscus, your body is going to signal, hey, we tore the meniscus, we need stem cells to come in here and help repair. If you're 25 years old when that happens, your ability to heal is a lot more efficient than if you're 75. So putting stem cells into that area is just going to increase the body's ability to repair and restore itself. And
interesting.
Nothing is perfect,
obviously,
but depending on the research and the clinical information that you read, stem cells are about 85 to 90% effective typically. Which is what people are finding. But each individual case is different.
And I know you have to be careful. You can't say we're going to, perfectly solve everybody because nobody can say that.
It would be nice if we could, but it just doesn't work.
That was like when we would feature shows on Channel 6. I couldn't say you're for sure you're going to have 80 people coming through your door. You just can't do that. So I understand that. I know. I had my little list of questions and stuff, and I know you kind of wanted to talk or show some things too.
Yeah. So I thought we would just kind of go through from start to finish how a patient is processed. So, when we talk about, the success rate being 85 to 90%, again, that's just a ballpark figure. The most important thing is our upfront evaluation. So, we always do free consultations because we need to determine if a patient is right for this treatment, if their condition is, if this is something that would be indicated. So, we always start with a full history. We evaluate any blood tests a person has, any x-rays, any MRIs, anything like that, to get a good look. So if somebody has a bad knee, for example, we go through a full history. What have they tried? How has it worked? What things haven't they done? Sometimes, we'll send a patient out for a different treatment first. So sometimes we'll have a patient that's got a knee issue. We'll send them out to get some gel injections first to see how they work and to better prepare the joint. We always want to take a look at an x-ray, see how much cartilage is left. Is there any need to consider bracing that knee? And then also the patient's health. We want to make sure they're going to be healthy enough to handle it. So,
makes sense. And
that's another reason we like to use the umbilical stem cells, because if you take bone marrow out of a person's hip, if they're on a whole host of medications, if they're on a blood thinner, if they have an autoimmune disease, there are factors that will affect the quality of their stem cells. With the umbilical cord stem cells, you don't have to worry so much about that.
That makes sense. One question, so we're at Minnesota Joint and Spine. I'm with Dr. Joe Biernat. For those of you who don't know, my name is Carla Berlin, and we're talking about regenerative medicine, stem cell therapy. But one question, and we're talking about for those of you who have pain, whether it's joint pain, back, neck, knee, we were specifically speaking about. But we were talking earlier about a lot of people in my industry and Botox and having to do fillers and things. You can also do, but do you use the umbilical stem cell therapy for that too then?
For you're talking about a non-surgical facelift?
Non-surgical facelift he was talking about, Because I was joking and I said, do you have something you can do with this stuff to make me look younger? And he's like, actually, I can.
So we do stuff for hair replacement. And we also can do what they call like a vampire facial or a non-surgical facelift. So you take a mesoderm pen, you make a bunch of puncture sites in the face, and then what we do is we'll take some blood out of the patient, like we talked about the PRP. We'll spin it down. We'll take this extracted portion here, just this red concentrated portion, and then we'll mix in the stem cells with it. And then in terms of facelift, then it just gets rubbed onto the face.
Is there any downtime with that?
Nope, no downtime. You come in, you get it done.
So if I
your face will be irritated and red for a little while. You won't put makeup on for a few days, but other than that, no downtime.
So if I all of a sudden look really good, you'll know.
You'll know it's been,
Yeah.
it's been lifted.
But, and then of course, and I joke, but actually I'm not joking, but for those of you who are struggling with pain, we were in the midst, he was explaining that as well, and that is why we are here today.
Right.
I want to help, that has always been my thing, I want to help people solve their pain, but now I actually have the opportunity with Dr. Joe Biernat for those of you who do struggle with various pain, even plantar fasciitis to arthritis to osteoarthritis, I mean, soft tissues.
Yep, tendonitis.
Joint pain.
And really, anywhere you want to stimulate the healing process, you can do it.
So, and I know I kind of interrupted what the process, but I don't know if we had gotten through all of it.
Well, once the patient gets through that initial intake portion,
yes.
where we do the consultation, we evaluate all their medical records. If they don't have X-rays of the area, or we feel like an MRI is necessary, we may order further testing, something like that. And then, once we've determined, this is something that we can deal with, then what we do is we just schedule an appointment for them to come in and actually have the procedure done.
Wow.
So if it's a joint, we use the ultrasound to help guide the injection, make sure we put it in the right place. So you always want to be very thorough about your initial evaluation of the condition, and then obviously when you do the actual treatment, you want to be very cognizant of where you're putting the stuff, and you always want to give that patient the best odds of things getting better.
Yeah.
And certain times we'll refer a patient out for some PT in the area. We may do some ultrasound, some other ancillary things to help promote the healing process. And we always give the patient home care instructions, prep instructions before the injection, post-care instructions afterward, and then we'll meet with them on a regularly scheduled basis to monitor. We'll have them come back usually a few days later or about a week later to make sure there's no kind of infection or irritation in the site, and just kind of monitor our progress.
Wow.
And usually what people are finding is usually within about 48 to 72 hours they're starting to notice some improvement. They're not perfect at that point, but that process is starting.
Well, and it's like with any healing. There's no magic wand or anything. Right.
We wish.
Well, and to segue just for a second, Diana had thanked you for the answer, but then my mom had asked, as you know, Mama Sandy, will the injection, and I think she was thinking the stem cell therapy, but she said the injection of vitamins, help a fatigue cancer patient?
That's a big, broad question. So we would have to, obviously you're not treating the arthritis. Right. You would be supplementing the patient nutritionally to help support proper function. So it would be, and I'm not trying to dodge the question.
No.
It's a matter of
I knew it was a loaded one.
Right. It's a matter of evaluating, the medical history, taking all of the testing and stuff that has been done, run any other testing. But as a general rule, nutritional support can help with all different types of fatigue. And
she is a big advocate of that. And Joe is being professional, but Joe knows her family. And for those of you who had followed when I even had my mom on the show, I mean, she was born deaf. She has MS. She's terminally ill with metastatic bone cancer and has taken chemo for 9 years. So that's why Joe's like, I'm not trying to dodge the question.
No,
but I know what's going on here. And he knows with the HIPAA laws and stuff, he can't. So Mama, we'll have him come over and talk to you privately. Yeah, you're really putting him on the spot. But anyway, so when you were, I know I said we had to segue back, but back into what you were kind of saying before about.
Well, let's use a knee patient for example. Okay, so we've gone through their history. We've got the X-rays. We've determined what level of arthritis is there. We've determined there's still enough cartilage for us to work with. We've gone through their history, made sure that they've tried everything. Then once we schedule that appointment which we schedule out for about an hour, they will come in, and we can either do mix with blood, or we can just use saline. Sometimes in the older population we have trouble getting the blood out of them. So we'll just mix with the saline. The important thing to get in there is the stem cell. If we can use the blood, great. If not, we use the saline. So in a patient that we can use the blood, they'll come in, we'll draw the blood out of them. That goes into the centrifuge for about 15 minutes.
Okay.
While that's going on, then we're going to evaluate the knee, figure out where our injection site is going to be, watching on the
Right on here.
ultrasound. Yeah.
Oh, wow.
And then once the PRP comes out, we'll take this yellow portion, we'll draw that off, we'll pull out the good platelet-rich plasma, we'll draw in the stem cell, and then we'll go ahead and do the injection.
Oh, wow. That's amazing.
And then we
Yeah.
usually keep people here for about 20 minutes after, just to make sure everything's okay.
Wow. So there's really not even a lot of downtime with that. If it's somebody in from work, they can go back to work, or do you usually?
If they would like to, yeah.
Yeah,
We just
wow.
have them kind of stay off the leg for, it's a procedure that you want to get better, so we tell people, give it every opportunity to heal.
Right.
Stay off of it.
Yes.
Don't go golfing 2 days after you do the injection. Things
Right,
like that.
because
So
then you can't,
you got to give it its opportunity to heal. It's an
Yeah.
injured joint or whatever.
you can only do your part, they have to do theirs.
That's right,
And
that's
it's
right.
common sense,
Yeah.
but sometimes common
Yeah.
sense isn't as
Right.
common,
Right.
as we all know.
So, but we give them very specific instructions on, what to do, exercises to do at home and things like that when it comes to the knee. So, and sometimes, we'll give them something more than just home care exercises.
Mm-hmm.
We'll say, we should probably send you out for some specific physical therapy and things like that. So,
Well, and I have a relative who is deathly afraid, needs a knee transplant, is deathly afraid of it. So this
Mhm.
she'd be a good candidate for this. And we were all teasing her for being afraid of knee replacement
Sure.
until I started reading up when I was preparing for both this last interview and this one.
Mhm.
He's been really nice, and what he said, there are a lot of serious things that can go wrong, like with
Mhm.
any surgery, and of course there are some people that are the candidate. But what's wonderful is we're talking about regenerative medicine. We're talking about stem cell therapy. We're talking about an opportunity where you don't have to have surgery or any downtime, or it's at least a good place to start.
Right.
Like he said, when your car breaks, you don't just go replace the motor, the motor or the engine right away. You start with what's wrong,
Right.
and sometimes it's tires, sometimes it's something else, but
Yeah.
certainly not an $8,500 engine,
Right.
as was with my car a couple of years ago. So in talking about that, if you're someone who suffers from back or neck, elbow, shoulder,
Mhm.
knee, ankle, foot, and then we were talking about some degenerative diseases too, like, do you want to name off some?
Arthritis in the spine, arthritis in any joint really.
Yeah,
And
which
then
is painful.
we also do hair restoration and
I think that's cool. I
Vampire
didn't know about
facelift.
that and the facelift part. I
Yeah.
mean, I might have some friends.
well, the Kardashians.
And it's affordable.
The Kardashians do the vampire facelift. So
Yeah, they
I know
do.
Diana
So-
commented on that.
Yeah, she did. So I'm really appreciative of you sharing that, and appreciative to all of you that are online right now. We've been talking about anything from osteoarthritis to arthritis, tendon, ligament, muscle tears, joint injuries, carpal tunnel, tendonitis, plantar fasciitis, soft tissue injuries. And the reason I'm listing all those off is almost everybody I know knows of at least one, if not, I could probably name you 30 people that suffer from various pain.
Right.
And Dr. Joe Biernat can help you. He is great at what he does, and this is the future right now.
This is. I believe it is. Yeah.
When you started talking to me about it and I was doing my homework, I'm like, yes, I want you featured on Around Town TV, because we are known as a TV show that features the best kept secrets in businesses. And even though this has been around for 50 years, what you're doing with it is phenomenal.
Right. And it's not just us. There's other clinics in the cities that are doing great things with stem cell and around the country.
Right.
I mean, every
right.
day more and more information comes out, and it's a good alternative for people in a lot of cases.
Right. Well, we shared this to specific family chiropractics page as well as Minnesota Joint and Spine.
Mhm.
It's shared to Dr. Joe Biernat's page as well as mine. So if you're somebody who wasn't comfortable asking or you wanted more information now, and you obviously don't want to just do that publicly, you can private message one of us, and if you can't get to his page, I will introduce you. But what is a good way for them to contact you?
They can just call the office.
And that number is?
763
Yep.
780-0112.
Perfect.
And they can just leave a message
If it's after hours. Yeah, if you leave a message tonight, you'll get back to
Yep.
them. And is there an
Tomorrow.
email or no?
They can go to the Minnesota Joint and Spine
Facebook page?
Website.
Minnesota
Go
Joint
through there.
and Spine website.
Yep.
And email through that.
Yep.
Yes.
And specific family chiropractic, you can go through there too.
Okay, you can
And
also go to the
through there.
specific family chiropractor, and of
Yep.
course Messenger through Facebook.
Yep.
On all of the pages, and this went out to 8 different pages. So, and I will go in and link all of them for you too. But is there anything else that I've missed? Did we
I
cover?
don't think so. We've covered quite a bit. If anybody has any questions,
Mm-hmm.
and if they're not sure if this is right for them, like I said, I always do consultations for no charge. They can come in, and even if they are a candidate and for whatever reason they're not comfortable, or it's not something that they want to do, they're not committed to anything.
No, so just coming in to find out, and I can tell you, I've had to have a lot of service people come out to my home lately. People drive for drive time now. $40 to drive to my
Right.
house to fix a sprinkler head that costs $20-some, $65 in labor. So just to come in to find out, it's worth it.
Yeah.
It is so worth it if you're someone who suffers from pain. I know my mom suffers from pain, and every single day, which is why she was asking those questions. Azella Wood said, "Hi, Joe." Yep, and Lee Nelson said hi to me. We need good caregivers. Thanks, Dr. Joe and Carla. You're welcome, and I can tell you he is one of the best.
And I also do in-office seminars.
Oh,
So if people are interested
Yes.
and they want to come into I just do a free stem cell classes. They can just call the office, find out when they are. I'll be scheduling a couple more tomorrow.
oh, that's
So,
nice.
yeah, they can come in. It's I usually about a half hour, 40 minutes, but then, it's a group of people. We go through some questions. I get more in depth about the umbilical cord stem cells specifically and more about our treatment. So if they're considering it and they don't want to do a one-on-one, that's a way that they can come in and sit in on the class, and sometimes they get a discount on their treatment if they decide to do it after coming to one of my seminars.
Ooh, did you hear that?
A little bit of bribery.
Yeah, a little bit of
A little bit of
bribery,
bribery.
but bribery works when you're in pain. And
Right.
and for those of you who jumped in and out, and I've said who I was, and Dr. Joe Biernat from Minnesota Joint and Spine, I did go over his bio, but one of the things that I want to reiterate to you is, I've known him for a long time, and anything you touch turns to gold. I mean, when he got into hockey and baseball, he played professionally. He was always the best at what he did, and I can tell you are with this, and I know it's something that is very important to you and you're passionate about,
Very
which
important,
always
yes.
makes you, stand out at one of the tops. So
Yeah.
I don't endorse just anybody, I highly recommend you at least giving him a call and talking to him about it. I know I will be.
Good. Good.
And we'll go into there. Anything else? Did we cover?
I've got nothing unless you got some questions. Or...
I was looking at, looks like most of our questions got asked.
Okay.
Tony Donatelli said, was being very supportive of us, and Diana and my mom, and we've had, a lot of people going in and off online that haven't, so I'm hoping you'll private message us as well. I really, really appreciate you tuning in. Around Town TV has been airing since, we've started our I think we started our 16th year on air in January of this year. I know we did, but I was trying to think of the edition we're at, but I think it's like the 137th edition. And we used to do every 3-week shows. Now we do a weekly show. So every Tuesday night at 7 p.m. Central Time, if the live streaming is working, we'll be right here, where you can always tune in. And I look forward to, I will be here next, I won't be with this clinic next Tuesday, but I'm hoping Joe will come back and we'll do another one.
Sure.
And this was the first time in the clinic with me trying a new software, so now we know what we need to do next time we're back. So we'll make it a little more streamlined for you. But if you have questions, go to Specific Family Chiropractic's website, or you can go to the Minnesota Joint and Spine's website. Everything will be tagged here, and please reach out. Get some resolution to that pain. Let him at least try to help you. And for those of you who are, tuning in and maybe don't even know who I am, my name is Carla Berlin from Around Town TV, Dr. Joe Biernat from Minnesota Joint and Spine, and I will see you next Tuesday, and hopefully you'll see Dr. Joe back on in a couple months again. We'll see you next time. Thanks so much. Bye-bye.